what are the benefits of wearing a compression garment and binder, and why do we need them? Again, this is me. This is my view on it. And I think sometimes patients like to have things black and white. Got to wear a compression garment for 4 weeks or 6 weeks or something like that, day and night. Mustn't take it off. It's important for your recovery. And I think it's good to engage patients with their recovery. And I think it's good to involve them with their recovery and give them ownership of the recovery. So I think it is a good thing to engage patients in that way. But if one of the problems with this sort of stuff is that sometimes people get into the sort of minutiae of it and get into the science of it and ask questions like this, what's the point of me wearing the compression garment? So if you're asking the question, what do I really need it and what is the point of it? In my view, in my experience, and in my hands, the point of the compression garment is for comfort, and it is to help with the swelling, because there will be swelling. If you've had some liposuction, tummy tuck, something like that, or breast surgery, you put them in a post-op bra, which is sort of like a compression garment. If you have a gynecomastia, that's where the binder comes in, the vest. So all these sort of body contouring surgery. Did I do a blog post about this? I think I did a blog post about this. Yeah, I did now. I've got to prepare with that. So all these compression garments do help with the swelling, and they do help make it feel comfortable. If you're going out and about, then it can be more comfortable wearing a compression garment. But it's not written in stone. Here we go, post-op compression garment. I knew I did. It's not written in stone. So if it's uncomfortable, if it digs in, I say to people, if it's really uncomfortable, if it's digging in, here we go. I did a blog post about compression. Oh. So if it's really digging in and everything, then I would say it is not written in stone, and it is there for your It is there for your comfort. And so if it's uncomfortable, you don't have to wear it. I would say, check with your surgeon, but I would say you need to wear something supportive. Did I just do a comment with the? Did I do a comment? I meant to do a comment then. Did that work? Anyway, I have done a. Did I do a comment then? Did that come out? Just put the link. Anyway, so if it's really uncomfortable, you can just wear a tight top. Those big pants. A lot of people say, I've just had a tummy tuck. I don't want to wear those big pants. That's the whole point of me having a tummy tuck. Don't want to wear those big pants. But I'm like, yeah, but just in the immediate post-op period, if the compression garment we give you is uncomfortable because they are quite bulky and you want to wear something instead, then you can. When we do gynecomastia, we give them these big expensive vests, and sometimes they wear these tight t-shirts, like the rugby players wear from JJB Sports, which are a lot cheaper and a lot more comfortable. And especially if it's summertime, you can wear a t-shirt over the top of them. So you don't, in my practice, so this is just in my practice, I would say you don't have to wear the compression garment we give you. You can wear something else. You can use something else. The other thing is that I always say to people, particularly with the abdominoplasty after a tummy tuck, if the binder's digging in, especially when you first have it, because you're all bent over and it's digging in and causing red marks and stuff. When we do breast reconstruction, there's one way of doing breast reconstruction called a tram flap, where you take the same tissue you take with the tummy tuck and tunnel it up into your breast to reconstruct the breast. And in those situations, we don't want any compression on the tummy because the blood supply is still attached and it's in that tunnel that goes up into the breast. And so we don't use a garment at all for pedicle tram flaps. And, it's not a disaster. You don't get loads and loads of seromas and swellings and discomforts. So it's not a disaster if you don't use a garment. Having said that, I think they are good, and I think they do help with swelling, and they do feel supportive. So that is why you need them. And